Most people enroll in Medicare as they turn 65. Your initial enrollment period is the 7-month window around your birthday month, and that is when you're required to enroll in Medicare Part A, inpatient coverage, Medicare Part B, outpatient coverage, and Medicare Part D, prescription drug coverage. However, if you or your spouse are actively working past your initial enrollment period and have creditable employer health insurance through your own employment or your spouse's, you can delay enrolling in Medicare indefinitely and not be subject to any of the penalties. Now, in that statement, I just used two very important terms that you must know and understand. The first term is your Medicare initial enrollment period. As I mentioned, this is a 7-month window around the month that you turn 65. It covers the 3 calendar months before your birthday month, plus the 3 calendar months after your birthday month. Now, this rule has one exception, and that is if your birthday month, like mine, is on the first day of the month. Then the entire enrollment period moves forward by 1 month. Now, we see confusion with enrollment periods so much that I created a free calculator that you can use to determine your initial enrollment period. And I'll show you how to get that free calculator in a moment. But first, if we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. We are one of the country's premier insurance agencies specializing in Medicare. In fact, I'm licensed in every state except Massachusetts. And our services are free to you, the consumer. So reach out to us for expert guidance. You'll be glad you did. And if you learn from this video and you want to see more of my content on Medicare, please press the like button and subscribe below. And also select the bell icon so you're notified when new videos are published. And if you already are a subscriber, please check that bell icon. We've noticed that many of our subscribers are not being notified when new videos are posted. All right, to access your free Medicare Initial Enrollment Calculator, you just go to my website, MedigapSeminars.org. Put your mouse cursor over the Resources tab and select Medicare Calculator in the drop-down menu. You input your date of birth by year, then month, then day. For example, choose 1959, then December, and then 20. This shows your Medicare can start no earlier than December 1st. And as this illustrates, you can apply for your Medicare or enroll starting September 1, 2024, and no later than March 31, 2025, without a penalty. Now, if we change the date of birth to the first day of the month, the entire enrollment period moves forward by 1 month. The second term that is very important for you to be very familiar with is creditable coverage. What is creditable coverage? In general, Medicare's definition of creditable coverage is health insurance that Medicare deems to be at least as good as original Medicare Parts A and B, and the same with Part D for prescription drug coverage. In reality, there are so many exceptions to this rule that, in my opinion, that definition is nearly useless. For example, employer group health insurance is generally considered creditable coverage. However, you must be actively employed. That same health insurance as a retirement benefit is not considered creditable. You could also have creditable health insurance from your employer that offers a prescription drug plan, but the prescription drug portion is not creditable. Also, your employer must have at least 20 employees. That same insurance from a smaller company of less than 20 employees is not considered creditable. COBRA is not creditable insurance. So it's the same insurance that you had when you weren't paying it as COBRA, but once it becomes COBRA, it's not creditable coverage. Your ACA plan, which is the marketplace individual under 65 health insurance, is not considered creditable. There are other exceptions as well, which is why I put together this Medicare Creditable Health Insurance cheat sheet. It's available for free on my website, and it's linked in the show notes below. So please feel free to save it, share it, print it out. Use this cheat sheet as you wish. I only ask that if you do, please let me know in the notes below so that I can have an idea of how many people find this helpful. And the same with the Medicare calculator for enrollment as well. Thank you. If you have creditable health insurance coverage, you can delay enrolling in Medicare indefinitely. If you do not have creditable coverage and you miss your initial enrollment period, your next opportunity to enroll is during what is called the general enrollment period. This is the first quarter of every year from January 1 through March 31. You can enroll in Medicare Part A or Medicare Part B during this period, but not Medicare Part D, and I will revisit that in a moment. One big word of caution: if you have employer group coverage, and this is very important for 2025 and beyond, because Medicare Part D plans have a new maximum out-of-pocket limit of $2,000 for 2025, many prescription drug plans that are part of otherwise creditable health insurance from your employer will not be creditable for Part D after 2025. Medicare will give them a pass for 2025 because this snafu is an unexpected consequence of some poorly thought out legislation. So if your employer prescription drug plan is not creditable, you will need a standalone Part D plan along with your employer coverage. Now, I'll have more on this when we talk about Part D and later on in this video, plus an entirely separate video on the subject available shortly after this video is published. So make sure that you're subscribed to my channel to be notified when that video is released. So what is the penalty for not enrolling in Medicare? Well, let's look at these penalties part by part. There are different penalties for Medicare Part A, Medicare Part B, and Medicare Part D. And we'll start with your Medicare Part A inpatient coverage. For most people, there's no penalty for not enrolling in Part A of Medicare. If you or your spouse has worked and paid Medicare taxes for at least 10 years during your lifetime, Medicare Part A inpatient coverage is already fully paid for. In that case, there's no penalty associated with delaying Part A. If your Part A is fully paid for, you can enroll in Medicare Part A at any time during or after your initial enrollment period with no penalty. And you can even do so while delaying your Medicare Part B enrollment. Each part of Medicare is considered separately. If you are divorced or widowed and were married for at least 10 years, you can use your ex-spouse's Medicare and Social Security eligibility. You'll likely need documentation of marriage and divorce or death to do so. If your Part A is not paid for through payroll taxes, you can purchase Part A by paying a separate monthly premium. However, in that case, you must enroll in Medicare Part B to get your Medicare Part A. You can also be subject to a late enrollment penalty if you don't act when you first become eligible for Medicare. As an aside, you may have just noticed I said when you're first eligible for Medicare and not during your initial enrollment period. The reason for this is that in order to be eligible for Medicare, a person must be a U.S. citizen or legal resident and living in the United States for 5 consecutive years. Many legal immigrants who've come to the U.S. in their senior years do not meet those criteria until sometime after age 65. So, for those few who must pay for their Part A separately, if you do not enroll when you're first eligible for Medicare, you'll have a 10% penalty that you will pay for 2 times the number of years that you missed. For example, if you failed to pay for your Part A for 2 years after you were eligible, then your 10% penalty will last for 4 years. Now, let's look at the Medicare Part B penalty. The penalty for not enrolling in your Medicare Part B during your initial enrollment period and not having creditable coverage is 10% of the monthly Part B premium for every 12 consecutive months that you were not enrolled in Medicare and did not have creditable coverage. You will pay this 10% penalty every month for as long as you have Medicare. For example, let's say that you were eligible to enroll in Medicare as of July 1 and you missed your initial enrollment. I mentioned earlier there's a general enrollment period from January 1 through March 31. If you do not have creditable coverage, you cannot just enroll whenever you want. So your first opportunity to enroll is January for a February 1 start date. And that means that you missed 7 months from July through January. Now, because that time period is less than 12 consecutive months, there's no penalty. But what if you put off enrolling in Medicare for another year. Then by next January, you'll have missed 19 months. And if you enroll then, you'll be subject to a permanent penalty of 10% of your Part B premium. That 10%, by the way, is not fixed. It will adjust higher over time and over the years as the Medicare Part B premium increases. If you are a higher income individual and you are subject to IRMA, the income-related monthly adjustment amount, and pay more for your Part B because of that, that 10% penalty is on your base premium, not your IRMA surcharge. You add the IRMA surcharge after the penalty. And obviously this is a penalty that's easy to avoid and is something that you're very definitely going to want to avoid. Now, if you're a higher income individual and you're not familiar with IRMA, you can check out the video I have linked above my left shoulder. So what I've seen more than once is that some people find themselves in a position where they simply cannot afford the Part B premium and they put off enrolling for that reason. Please don't. Please contact your state or Commonwealth Department of Insurance. Every state has multiple programs to help low-income people pay their Part B premium. Now, this is not Medicaid. It's simply help from the state so that you have your Medicare insurance and are not digging yourself into a hole with penalties. So next, let's look at the Part D prescription drug plan penalty and how to avoid it. You can get your Part D prescription drug plan either as a standalone plan, which you do if you're keeping your original Medicare and perhaps adding a supplement, or you can also have Part D bundled with a Medicare Advantage plan. You can also have creditable Part D coverage through your employer group health care. Check with your benefits department to make certain your employer-sponsored prescription drug plan is creditable coverage, and that can change annually. Your employer is required to send you an annual notice to keep you informed. Either way, you will have Part D and not be subject to a penalty as long as you're enrolled in Part D or had creditable Part D coverage. So you can enroll in Part D as long as you're eligible for Medicare Part A and you have a Medicare number. You are not required to be enrolled in Part B, your outpatient care, when enrolling in Part D. If you have an employer plan, your employer is required to send you a notice of creditable coverage every year, or a notice that your Part D is not creditable if that's the case. Always keep those notices. If you do not have creditable Part D coverage when you are supposed to, the penalty is 1% per month every month that you miss. So that's 1% of the national base Medicare Part B premium. As I do this video in 2024, that's somewhere around $35. The penalty is then rounded to the nearest 10 cents and added to the monthly premium of the Part D plan that you have selected, and that will continue for as long as you have Part D. Now, many people believe that they can avoid this penalty if they enroll in an Advantage plan, and that's not true. You will pay that penalty as long as you have a Medicare Part D. Like the Part B premium, the national base Part D premium changes every year and your penalty changes or increases with it. This is important. Although this financial penalty can add up if you missed your enrollment, it's not the worst potential penalty you can face when missing your Part D. What's the worst penalty you can face? The worst penalty occurs when you need your Part D insurance and you don't have a Part D plan. You can't just enroll in Part D whenever you want. You can only enroll in Part D during your initial enrollment period or the annual election period from October 15th through December 7th for a January 1 start date. That's it. And when you're without your Part D, the average cancer drug's over $10,000 a month. In fact, when you look at the 6 most often prescribed prescriptions in the United States, prices range from $200 a month for Crestor and $3,500 a month for Humira. As of 2025, if you have a Part D prescription drug plan, your out-of-pocket expenses are capped at $2,000 a year. And that's for the prescriptions that you pick up under the Part D plan. If you cannot afford the Part D prescription drug plan premium or your prescriptions, every state has different levels of help that they will offer you. So contact your state Department of Insurance for help. You can avoid the Part D penalty by getting your Part D plan either as a standalone prescription drug plan or bundled with an Advantage plan or as part of your employer coverage while actively working past age 65. So a number of years ago, a lady client of mine decided that she didn't want to pay for her Part D because she had no need for prescriptions. Less than a year later, she was over $370,000 in debt due to the prescription costs she had for cancer because she didn't have Part D. And since then, I've seen others face bankruptcy in retirement for the very same reason. I know that was a lot of information to take in, but there is more. There are other questions we're often asked that I believe are appropriate to address here. Those are questions like, how do I tell Medicare that I have creditable coverage so they don't penalize me? Or how do I enroll in Medicare, and when can I enroll in Medicare after I've delayed enrollment due to creditable coverage? Or what happens when I quit my job or they lay me off after age 65? What if I have VA coverage or Tricare for life? How is my Medicare impacted by my HSA plan? And last but not least, which is better, my employer coverage or Medicare? So let's take a look at those questions one at a time with some very brief and precise answers. And if there's a question that you have that I didn't answer, please ask it in the comments section below. I'll do my best to answer or to point you in the right direction so that you have that information. So first question, how do I tell Medicare that I have creditable coverage so that they don't penalize me? Well, the answer is you don't have to. You don't do anything at that time. You just go ahead and continue with your employer coverage, your creditable coverage. However, when you're ready to drop your employer coverage and start Medicare as your primary insurance, you need to download a copy of Form CMS L564. This form is completed by both you and your employer. And if you have difficulties with your employer, there's instructions on what to do in that case. With this form, your employer attests that the group health care you had was creditable. So you simply search the internet for CMS Form L564. Get that form that you need, download that most recent copy, and deliver the completed signed form to your local Social Security office. Next question, how do I enroll in Medicare, and when can I enroll in Medicare after I've delayed enrollment due to creditable coverage? When you have creditable coverage and are past your initial enrollment period, you can create your own special enrollment period at any time simply by turning in that form, the signed form CMS L564. Medicare always starts on the first day of the month. So you simply choose which month that you want your Medicare to start, then apply for your Medicare Part B. You apply for your Medicare Part B on the Social Security website. So you'll get the form, have it completed by you and your employer, go online to the Social Security website or local Social Security office and apply for your Medicare. And remember, this has nothing to do with Social Security. Your Social Security and Medicare are separate, but they're both handled through the Social Security office. So next question, what happens when I quit my job or they lay me off after age 65 or you retire? So if you're past your initial enrollment period and you quit your job or retire, thus you're no longer eligible for creditable group coverage, you have an 8-month window to enroll in Medicare Part A and Medicare Part B. And that window begins the month that your employment ends or your health insurance ended, whichever came first. And that is for Medicare Part A and B. You have only 63 days to enroll in your Medicare Part D prescription drug plan when you lose your creditable coverage. So don't assume you have the same 8 months for your Part D prescription drug plan. You do not. Next, what if I have VA coverage or Tricare for life? VA coverage has historically been considered creditable for Part D or prescription drug coverage. So VA has been, and you may want to check for changes and going forward, but has always been considered creditable for Part D prescription drug plans. But it is not creditable coverage for Medicare Part B outpatient care. We advise veterans who use the VA to also get their Medicare Part A and Part B, and then add a high deductible Medicare supplement plan. That way, you can get health care outside the VA when needed, and you have limited financial exposure and absolutely minimal premiums to keep up with the cost. So those with Tricare for life are set and should not add a Medicare Advantage plan, Part D plan, or a supplement. For more on Tricare for Life, check the video above my left shoulder. I have a video specifically for that. Next question, how is my Medicare impacted by my HSA plan? Once you've started Medicare, you may not continue to contribute to an HSA plan. You can use it, but you can't contribute to it. Where this becomes an issue is when you enroll in Medicare Part A after your initial enrollment period. And that is because your Part A hospital coverage will have a start date that is retroactive to your enrollment. So Part A will start either 6 months retroactive to your enrollment or on your Medicare initial enrollment date, whichever is soonest. Now, I have an article on my website with lots of details on how HSA plans work with Medicare and what you can and can't use it on, and I'm going to link that above my left shoulder and in the show notes below. It's a great article. If you have an HSA plan, check it out. Last question, which is better, my employer coverage or Medicare? Well, in my experience, over 90% of the time, Medicare plus a supplement is better health insurance coverage and a lower cost than employer group health plans. However, people become comfortable with their employer plan and often don't even do their research to see which is better or which is a better cost. To compare your plan to Medicare plus a supplement, I've created a free calculator that you can use. Just go to my website, MedigapSeminars.org, put your mouse cursor over the Resources tab, and in the drop-down menu, choose Compare Employer Plan to Medicare. Now, you'll need to know the details about your employer plan and how much your Medicare will cost, as well as the Medicare supplement plans in your area. So please contact us, and we will get the information on Medicare or Medicare supplement costs out to you. Once you input the data, this calculator will show you what your out-of-pocket costs will be for a typical $10,000 medical bill and compare your premiums. It's a great tool and it's free. Please let me know what part of this video that you found most helpful in the comments below. And please don't forget to like and subscribe for more Medicare content, and then share this video with your friends. And as always, reach out to my office if we can help you with your Medicare. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.